Basic of Incision and Drainage (IND) Captain Code Procedures. Accurate code selection for incision and drainage (IND) procedures is essential for proper reimbursement. IND is a common surgical intervention used to treat infections such as abscesses, cysts, and boils. This procedure involves making an incision in the affected area to allow the drainage of infected material, relieving pain and pressure while promoting healing. To ensure appropriate reimbursement, it is crucial to understand how to correctly code these procedures based on the complexity, number of incisions, and type of lesion involved. Key considerations for IND code selection. Incision and drainage procedures are classified under Captain Codes 10060, 10180. These codes differ based on the complexity of the procedure, the number of incisions made, and the type of lesion being treated. Certain key terms and phrases in the clinical documentation can help ensure accurate code selection. Some examples include: abscess indicates an infection that requires drainage. Incision refers to the surgical cut made for draining the abscess. Drainage, the process of removing infected fluid. Simple, a straightforward procedure with minimal complication. Complicated, involves multiple abscesses or additional surgical effort. Pilonidal cyst, a type of abscess located near the tailbone. Hematoma, a collection of blood outside the blood vessels, which may require drainage. Seroma, a pocket of clear fluid that may develop after surgery. IND procedure coding examples. To assist in selecting the correct Captain code for IND procedures, consider the following examples. Example 1, Simple abscess. A patient presents with a small abscess on their forearm. The physician performs a simple incision and drainage procedure to release pus, which is straightforward with no complications. Key points. Superficial abscess just under the skin. Minimal dissection and no extensive surgical effort. Quick recovery, with minimal complications. CPT code 10060. Example 2, Multiple abscesses. A patient has several abscesses on their lower leg. The physician performs an IND to drain the multiple abscesses and address surrounding infection, which makes the procedure more complex. Key points. Multiple abscesses in the affected area. Deep or extensive infection possibly involving deeper structures. Increased surgical effort and longer recovery. CPT code 10061. Example 3, Pilonidal cyst. A patient presents with a pilonidal cyst located near the tailbone, with minimal infection. The physician performs a simple IND procedure to remove the contents of the cyst. Key points. Pilonidal cyst near the tailbone. Simple procedure with minimal infection. CPT code 10080. Example 4, Complicated pilonidal cyst. A patient has an infected pilonidal cyst with multiple tracts. The physician performs a more extensive incision and drainage procedure, which includes draining the infected tracts. Key points. Complicated pilonidal cyst involving multiple sinus tracts and significant infection. Extensive dissection and drainage required. Higher risk of recurrence, requiring follow-up care. CPT code 10081. Example 5, Seroma drainage. A patient develops a large seroma after surgery. The physician makes an incision to drain the seroma and relieve pressure. Key points. Fluid collection, typically after surgery or injury. Draining fluid reduces pain and aids in healing. CPT code 10140. Example 6, Needle aspiration. A patient presents with a small abscess on their thigh. Rather than making a large incision, the physician uses a needle to aspirate the pus, offering a less invasive approach. Key points. Needle aspiration, a less invasive method. Suitable for smaller abscesses. Quick, outpatient procedure. CPT code 10160. Example 7, Postoperative infection. A patient develops a deep and complex infection at a surgical site. The physician performs an extensive IND to manage the infection, including the removal of necrotic tissue. Key points. Postoperative wound infection. Complex procedure requiring deep dissection and necrotic tissue removal. Close monitoring and follow-up care. CPT code 10180.